My name is Dr. Abhi Bhardwaj and I'm back with lecture series on science. Today I'm going to continue with the topic which we have discussed in our previous sessions, and it's about coronavirus. Today is February the 5th, and official figures from Chinese government about number of cases infected is 24,639 cases. Out of that, 3,223 are in critical condition. There are 493 deaths, and recovered patients number is 1,037. So before I start this discussion, I want to tell you guys that this is unprecedented, human tragedy unfolding in front of our eyes, and it's very heartening and sad to know, because these are human lives, which we are losing because of this novel coronavirus, which is going through China very, very badly. I have great sympathy for all the people who are going through this in China. And it's not their fault, but it's something which is for entire humanity. This is something which is of course very dangerous, I think. And what I believe is that the numbers we are getting from Chinese government, there is no validation, independent validation of those numbers, and actual numbers probably are much more higher than what they have been communicating. The biggest concern I have is that the virus is highly contagious, and what that means is that for and one more thing on top of that, there is incubation period which is about 2 to 10 days, and during that time patients or infected people do not show any signs, and they could be carrier and they could be spreading this disease unknowingly when they are infected. Now consider this. Chinese government says that the infected cases are 24,639 as of today, but actual numbers are much more higher, and there are some research models based on what probable numbers are, and most of them are pointing us towards 250 to 300,000 infections, and each individual is capable of infecting 2 to 3 people minimum, which means that say if it is 250,000, then those individuals are constantly infecting other individuals unknowingly, when they are in this incubation period, when they're carriers, and they can infect during that period. So that is the cause of concern, because that makes us extremely difficult to contain. China is going through very hard time right now, to contain this virus, but it's spread to many other countries already, more than 25 countries. So if you look at the numbers, there can also become very dangerous in coming weeks, because as I mentioned, that there must be many millions of people who traveled from China or from Wuhan to different parts of the world, and they were not showing any symptoms at that time, and those people might have been infecting other individuals in those countries, and we might see in coming weeks the numbers start swelling in other countries where we see lower numbers right now. And I feel really bad for China right currently, and I suspect that this might happen in many other countries, because we might see those infections which were basically spread through the individuals who were not showing any symptoms at that time. Other worry I have is that the vaccine is about a year from now, and what it means is that millions and millions of people could get infected within this year. And when you look at the death rate, for example, out of 24,639, There are 493 deaths only, but that's not only the thing you should be looking at. If you look at the critical patients number here is 3,223, which is about 13%. And critical cases currently are able to get, I hope most of them are able to get to the hospitals and getting, life support like ventilators. But imagine if millions of people get infected, all of them cannot be admitted to the hospitals, and the critical, cases would rise as well. And you can imagine then, very bad human tragedy unfolding. The cat is already out of the box, and it's extremely difficult now to contain it, in my view. Only thing, rest of the countries can do is make sure that they take the action at the appropriate time. Means, close down the schools, close down colleges, tell the companies to let their workers work remotely from home, so that we could at least delay the infections, because the virus is extremely contagious, and that would make a lot of people sick very quickly, and hospitals would be overwhelmed with patients all over the world. This is a pandemic which I think WHO should have done a better job here, by informing different countries at much earlier than what they did. In my view, this is going to be a very dangerous situation in coming weeks to months, unless and until we have the vaccination, which is about a year, from now. Other part of this virus is that we do not know exactly, what this virus is up to. Means that, what happens to the people who are recovered, for example. Is there a virus in their gut, and are they still able to spread this? Because then it makes it a totally different case, and that would be very difficult to contain. In addition to that, the virus mutates, and I know that, if that happens, then this will make even worse case, because even if we have the vaccination and the virus mutates, then that's a whole story altogether, and that would be extremely dangerous for entire humanity. We have seen similar tragedy in 1918, when 500 million people got infected and about 50 to 100 million people died. But this virus is much more contagious, much more worse than that influenza virus at the time, H1N1, because this virus is able to hide during the incubation period and spread to other humans. There are no symptoms like normal influenza or flu viruses. So this is very dangerous, very contagious, and the figures in current tragedy can go much more higher than what happened in 1918. We all collectively need to do something about it. Governments has to do something right away about it, and start preparing for the disaster which is coming. And also, personally, I think personal hygiene is extremely important. Making sure that everybody wash their hands before they touch the food. Do not touch your eyes and nose, and make sure that you use mask and some sort of eye protection when you go out. Minimize your public, going to the public or any places where you suspect that you can get infected. But most importantly, I think it's the governments who needs to understand this at a very critical level, and raise this awareness and make sure that we minimize at least the number of infections, because there's no way now to contain this virus the way it has been progressing in China. I suspect the same thing happening in many other countries very quickly, very soon. Thank you for watching.